How to understand high blood pressure readings. Two numbers create a blood pressure reading. Systolic pressure. This is the first, or top, number. It indicates the pressure in your arteries when your heart beats and pumps out blood. Diastolic pressure. This is the second, or bottom, number. It's the reading of the pressure in your arteries between beats of your heart. 5 categories define blood pressure readings for adults. Healthy. A healthy blood pressure reading is less than 120/80ths of a millimeter of mercury, mmHg. Elevated. The systolic number is between 120 and 129 millimeters Hg, and the diastolic number is less than 80 millimeters Hg. Doctors usually don't treat elevated blood pressure with medication. Instead, your doctor may encourage lifestyle changes to help lower your numbers. Stage 1 hypertension. The systolic number is between 130 and 139 millimeters Hg, or the diastolic number is between 80 and 89 millimeters Hg. Stage 2 hypertension. The systolic number is 140 millimeters Hg or higher, or the diastolic number is 90 millimeters Hg or higher. Hypertensive crisis. The systolic number is over 180 millimeters Hg, or the diastolic number is over 120 millimeters Hg. Blood pressure in this range requires urgent medical attention. If any symptoms such as chest pain, headache, shortness of breath, or visual changes occur when blood pressure is this high, medical care in the emergency room is needed. A blood pressure reading is taken with a pressure cuff. For an accurate reading, it's important you have a cuff that fits. An ill-fitting cuff may deliver inaccurate readings. Blood pressure readings are different for children and teenagers. Ask your child's doctor for the healthy ranges for your child if you're asked to monitor their blood pressure. Treatment options for high blood pressure. A number of factors help your doctor determine the best treatment option for you. These factors include which type of hypertension you have and what causes have been identified. Primary hypertension treatment options. If your doctor diagnoses you with primary hypertension, lifestyle changes may help reduce your high blood pressure. If lifestyle changes alone aren't enough, or if they stop being effective, your doctor may prescribe medication. Secondary hypertension treatment options. If your doctor discovers an underlying issue causing your hypertension, treatment will focus on that other condition. For example, if a medicine you started taking is causing increased blood pressure, your doctor will try other medicines that don't have this side effect. Sometimes, hypertension is persistent despite treatment for the underlying cause. In this case, your doctor may work with you to develop lifestyle changes and prescribe medications to help reduce your blood pressure. Treatment plans for hypertension often evolve. What worked at first may become less useful over time. Your doctor will continue to work with you to refine your treatment. Medication for high blood pressure. Many people go through a trial and error phase with blood pressure medications. You may need to try different medicines until you find one or a combination of medications that work for you. Some of the medications used to treat hypertension include beta blockers. Beta blockers make your heart beat slower and with less force. This reduces the amount of blood pumped through your arteries with each beat, which lowers blood pressure. It also blocks certain hormones in your body that can raise your blood pressure. Diuretics. High sodium levels and excess fluid in your body can increase blood pressure. Diuretics, also called water pills, help your kidneys remove excess sodium from your body. As the sodium leaves, extra fluid in your bloodstream moves into your urine, which helps lower your blood pressure. ACE inhibitors. Angiotensin is a chemical that causes blood vessels and artery walls to tighten and narrow. ACE, angiotensin converting enzyme, inhibitors prevent the body from producing as much of this chemical. This helps blood vessels relax and reduces blood pressure. Angiotensin II receptor blockers, ARBs. While ACE inhibitors aim to stop the creation of angiotensin, ARBs block angiotensin from binding with receptors. Without the chemical, blood vessels won't tighten. That helps relax vessels and lower blood pressure. Calcium channel blockers. These medications block some of the calcium from entering the cardiac muscles of your heart. This leads to less forceful heartbeats and a lower blood pressure. These medicines also work in the blood vessels, causing them to relax and further lowering blood pressure. Alpha-2 agonists. This type of medication changes the nerve impulses that cause blood vessels to tighten. This helps blood vessels to relax, which reduces blood pressure. Home remedies for high blood pressure. Healthy lifestyle changes can help you control the factors that cause hypertension. Here are some of the most common home remedies. Developing a healthy diet. A heart-healthy diet is vital for helping to reduce high blood pressure. It's also important for managing hypertension that is under control and reducing the risk of complications. These complications include heart disease, stroke, and heart attack. A heart-healthy diet emphasizes foods that include fruits, vegetables, whole grains, lean proteins like fish. Increasing physical activity. Reaching a healthy weight should include being more physically active. In addition to helping you shed pounds, exercise can help reduce stress, lower blood pressure naturally, and strengthen your cardiovascular system. Aim to get 150 minutes of moderate physical activity each week. That's about 30 minutes 5 times per week. Reaching a healthy weight. If you are overweight or obese, losing weight through a heart-healthy diet and increased physical activity can help lower your blood pressure. Managing stress. Exercise is a great way to manage stress. Other activities can also be helpful. These include meditation, deep breathing, massage, muscle relaxation, yoga or Tai Chi. These are all proven stress-reducing techniques. Getting adequate sleep can also help reduce stress levels. Adopting a cleaner lifestyle. If you're a smoker, try to quit. The chemicals in tobacco smoke damage the body's tissues and harden blood vessel walls. If you regularly consume too much alcohol or have an alcohol dependency, seek help to reduce the amount you drink or stop altogether. Alcohol can raise blood pressure. Dietary recommendations for people with high blood pressure. One of the easiest ways you can treat hypertension and prevent possible complications is through your diet. What you eat can go a long way toward easing or eliminating hypertension. Here are some of the most common dietary recommendations for people with hypertension. Eat less meat, more plants. A plant-based diet is an easy way to increase fiber and reduce the amount of sodium and unhealthy saturated and trans fat you take in from dairy foods and meat. Increase the number of fruits, vegetables, leafy greens, and whole grains you're eating. Instead of red meat, opt for healthier lean proteins like fish, poultry, or tofu. Reduce dietary sodium. People with hypertension and those with an increased risk for heart disease may need to keep their daily sodium intake between 1,500 mg and 2,300 mg per day. The best way to reduce sodium is to cook fresh foods more often. Avoid eating restaurant food or prepackaged foods, which are often very high in sodium. Cut back on sweets. Sugary foods and beverages contain empty calories but don't have nutritional content. If you want something sweet, try eating fresh fruit or small amounts of dark chocolate that haven't been sweetened as much with sugar. Studies. Trusted source suggest regularly eating dark chocolate may reduce blood pressure. Please continue watching part number 3 in High Blood Pressure Solution playlist and refer the natural way to improve your blood pressure at the first comment below. Thanks for watching.